Hello and welcome back to Patient Knowledge. My name is Dr. Kirmani and this channel is all about health education. For my new viewers and subscribers, I would like to mention that on every Saturday and Sunday, I upload new videos related to various health topics. So if you don't want to miss out on that, do subscribe to my channel. Also like and share to as many people as possible to spread the awareness. Today's topic is thyroid problems. Thyroid gland is a butterfly-shaped gland that's present in front of the neck and is responsible for maintaining the normal functioning of the body because it releases a chemical in the blood. Well, sometimes it can become underactive or overactive and can lead to various health issues. So today we'll be talking about thyroid problems. So let's get started and find out more about it. In this video, I will be talking about some of the symptoms of hypo and hyperthyroidism. We'll tell you what happens to babies who get hypothyroidism. Also, we'll talk about the diagnosis and treatment of thyroid problems, and we'll give you some home remedies. Towards the end of the video, I will give you a list of foods to be taken in hypothyroidism. So stay till the end. Now, here is a list of symptoms of hypothyroidism. Well, the metabolism is slow because of underactive thyroid gland, and the person who gets hypothyroidism may experience constipation, will have cold intolerance, will become sluggish and lethargic, may gain some weight. Upon looking at them, you can see there is marked pallor. They may complain of physical and mental slowing. Their hair, voice, and skin changes significantly with hair becoming thin and brittle, and there will be loss of hair. Their voice becomes husky. They may have puffiness of face and eyes, and the skin becomes dry and cool. There will be enlarged thyroid gland in front of the neck, which may be a problem to many because of the cosmetic problems. Well, hypothyroidism, if it's not treated and left as it is, it can lead to various health problems later on, such as obesity, infertility, heart disease, joint pain, enlarged thyroid gland, forgetfulness, and depression. Well, hypothyroidism in babies can cause various health problems such as jaundice, where the skin becomes yellow, and there's also yellow discoloration of the eyes. They may have a large tongue, a puffy face, will have frequent choking. If left untreated, later it can lead to feeding difficulties with developmental issues. These babies can have constipation and sleep problems as well. The hypothyroidism in teens can cause delayed puberty, poor mental development, delayed development of permanent teeth, and poor growth. On the contrary, hyperthyroidism is overactivity of the gland. So the symptoms will be related to speeding up of the metabolism. So the person with hyperthyroidism may be more anxious, nervous, and irritated. They may have problems sleeping with muscle weakness and a sudden weight loss without any apparent cause. Their heartbeat might be quite rapid with swelling of the hands. They will have increased sensitivity to heat and fatigue with loose bowel motions and of course an enlarged thyroid gland in front of the neck. Now, people with hyperthyroidism may have problems with vision and some of the obvious eye signs. This is called as Graves' ophthalmopathy, where the eyes may show certain signs such as the eyeballs protruding beyond the orbits. This condition is called as exophthalmos. The eyes become red and swollen with light sensitivity, double vision, blurry vision, and will have excessive discomfort in the eyes. Now, if you have any of the above symptoms of either under or overactive thyroid gland, it's time to see your doctor. Remember, the symptoms may just be tiredness with very little other symptoms present because the symptoms take long time to develop and it may be quite subtle in the beginning. So if you have any of them, just see your doctor. The doctor may run some blood works and they will check the thyroid function testing, where they're going to look for thyroid stimulating hormone T3 and T4. In underactive thyroid gland, the TSH levels will be high and the T3 T4 levels will be low. On the contrary, when the gland is hyperactive or overactive, such as hyperthyroidism, the TSH levels will be low and T3 T4 levels will be high. The doctor will also have a proper assessment of your health. They will check for any leaky gut, will check for your diet, any toxins, will look for any infections, and will try to find out if you've got any stresses in your life, because these are some of the important factors that can cause thyroid issues. The treatment depends upon under or overactive gland. In hypothyroidism, the treatment of choice is levothyroxine. Well, this is given in small doses initially, and gradually the dose can be increased up to a maximum of 50 to 100 micrograms. The medication is given until the TSH levels reach between 0.5 to 2 mu per liter, which is the normal level and is called as euthyroid state. Initially, the doctors may recommend to have more frequent blood checkups, say every 2 to 3 months, just to keep an eye on the TSH levels. On the contrary, for hyperactive thyroid gland, the medication will be totally different. It will be antithyroid drugs, which is radioactive iodine, that will slow down the thyroid. And sometimes surgery may be required. Now, people with thyroid problems should get regular blood tests. Should maintain a healthy lifestyle, where their diet should include freshly prepared home food and avoiding any processed food. Avoid any kind of stressors because it contributes to thyroid problems. So you can practice yoga and meditation to relax your mind and body. Get a good sleep. 6 to 7 hours of sleep is ideal. Cut down on tea and coffee. And of course, exercise is also one of the important lifestyle modification that should not be missed. Well, people with thyroid problems will have slow metabolism, especially hypothyroidism, so exercising will require more effort, and it's still recommended. Here's some home remedies. People with thyroid problems should avoid organ meat, cabbage, cauliflower, chocolates, cola drinks, tofu, and soybeans. They should take a gluten-free diet, eat raw onion, fresh coconut, fresh seasoned fruits, drink coriander water 30 minutes before breakfast, and massage the front of your neck with cold pressed walnut oil. Well, here's a list of foods that one should eat. Iodine-containing foods such as iodized salt, egg yolk, shrimp, and fish should be encouraged. Olive oil and coconut oil are also beneficial. Among the fruits, apple, pineapple, kiwi, and pawpaw should be consumed more frequently. Among the spices, black pepper, green chilies, turmeric, cinnamon, and ginger garlic are to be included in your diet. Now, the nuts contain selenium and manganese, which is good for maintaining normal thyroid levels. So, almonds, walnuts, cashews, chia seeds, and melon seeds should be included. Among the beverages, green tea, coriander seeds, crushed and boiled and then taken 30 minutes before breakfast is recommended. Gooseberry juice, long melon juice are some of the other kinds of juice that might be helpful. Oats smoothie is quite good as a breakfast. You can include some nuts in that. Carrot and orange juice, cucumber and coriander leaves juice are some of the other options that one can take. Well, that's all for today. I hope this information about thyroid problems was useful in understanding everything about this topic. Thank you for listening. If you wish to hear something about, leave it in the comment box below. Bye for now.